My name is Gary Kuykendal. I'm a physical therapist with Ortho Montana. I am certified in blood flow restriction, and we're going to give a little talk on that process of using blood flow restriction with exercise.
How does blood flow restriction work?
The process involves using a pneumatic sleeve or tourniquet, as we call it, and you apply it to the proximal limb, either a leg or an arm. And by that process of putting some pressure into that sleeve and then doing some exercise, you are restricting arterial blood flow into the muscle, and you are occluding the venous flow back out of the muscle. Now, because of that process there, then you will develop a hypoxic state in the muscle, and with this, you develop a increase of cellular swelling. Now, the cellular swelling, because it's so sudden, the body sees this as damage to the muscle, so it's creating a process called protein synthesis. Now, the protein synthesis rushes to the site to repair muscle, but the beauty of BFR is that it doesn't really cause a lot of muscle damage, if any. So because you're not trying to repair muscle, you can just get right into the strengthening and the building of muscle size.
Who may benefit most from BFR?
People that are status post-surgery or injury, the elderly that have osteoarthritis, people in preconditioning programs, and then people currently in their programs will benefit from this process.
How safe is BFR?
If a person's certified, such as a PT, this type of process is as safe as any type of traditional exercise, so thumbs up.
What are the contraindications for BFR?
Contraindications are people with very or extreme high blood pressure, people with a history of cancer, people with a history of peripheral vascular disease, and people with a history of blood clotting.
What type of blood flow restriction unit do you use?
This is the Delphi unit that we're using right now. We apply the tourniquet or the pneumatic sleeve proximal to the limb. As you can see right there, it's plugged in. This is an FDA approved device. And when you turn it on, it'll measure LOP, which is limb occlusion pressure, and then your working pressure. The working pressure is a percentage of what we set on the machine that allows them to try and deoxygenate the muscle as they're doing the exercise.
What's an example of an exercise you would use for blood flow restriction?
A common exercise that we use is called a long arc quad, and it's done with a very slow motion coming up to full knee extension and then back down to knee flexion. This process is done in a series of repetitions, going 30 for the first set, 30-second rest, then 15 repetitions, 30-second rest, then 15 more repetitions, then 30-second rest, and then 15 more repetitions to total up to 75 repetitions through one exercise such as you're seeing right here.
Can you use this application on the arm?
Yes, it's a different setting for the processor to put on percentages, but you apply it to the cuff like she's doing right there. You set your pressures. Once the pressures are set, then she can go through the exercises. So go ahead and lift your arm up this way. And again, you would do the process of 30, 15, 15, 15 with 30-second rest in between each set. And then when you are done with that exercise, you have a 1-minute rest before you do any type of other exercise.